Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health and the Wellness Forum Institute. Our annual Prevent Cancer campaign ends tomorrow, but there is still time to sign the pledge. Do that, and you get an invitation to a free workshop on how to prevent cancer that addresses some things like organic versus inorganic food and x-rays and things of that nature that people are real curious about. And also, you get a gift coupon, which you can apply to conference tickets. I'll just talk about one of our speakers. Each week, I've been talking about a different one. Some of you know about Dr. Mila Casey, an ophthalmologist who has some wonderful expertise in helping people to not just keep their vision from deteriorating, but improving it. And we have had many people who took her class earlier this year who have had noticeable and confirmed improvement in their vision since they took that class with her. So I think you're going to want to hear what she has to say. She's just one of several great speakers, and you can check out the whole roster at our website, which is wellnessforumhealth.com. We added a couple more options to your gift card as well. So, but you can do this. There's 24 hours left, and we can get a lot done in 24 hours, right? So, pampopper@msn.com. And also, feel free to ask me for my special report, which is free, Informed Decision Making for Cancer Patients. If you already have cancer, or you know somebody who does, these are some of the most important decisions that someone will ever make in an entire lifetime. So doing the right things and taking your time is real important. So happy to provide that to anybody who asks. All right. So I have two news items to cover with you. And they're both related to correspondence from people who read my newsletters or watch my videos. They both have to do with cancer. So I thought since we're wrapping up the cancer campaign this week, I'd spend another video on cancer-related issues, and then we'll go to some additional topics starting next week. All right, so a subscriber writes to me, quote, "I take issue with your stance on cancer screening programs. My sister was a beneficiary of mammography screening. She was diagnosed with cancer. It was caught early, and she says she's alive today over 10 years later because of screening. I think it could be dangerous to tell people not to be screened." And here is my response that I wrote back. First, I don't tell anybody to do anything. I think that issuing instructions to patients is the worst form of medical care, regardless of who is giving the instructions. I'm an advocate for informed medical choice. And for an informed choice to be made, the patient has to understand the risks and benefits of any healthcare that's being recommended. Doctors tend to focus on the benefits and often fail to communicate much of anything about risks. Second, the subscriber doesn't provide any details about his sister's cancer. Overdiagnosis and overtreatment are some of the most important risks to consider before agreeing to a mammogram and many other screening tests as well. If this person's sister had ductal carcinoma in situ, for example, she may not have actually been a cancer patient, but been mistakenly labeled as one and received unnecessary treatment. And the treatments for not cancer have grown increasingly aggressive during the last several years. But let's assume for the moment that this woman really had cancer and that it was aggressive and that treatment saved her life. This happens. The problem is it's not likely to happen to you, the woman who's being recommended to have a mammogram now. The odds are much greater that you'll be harmed than helped. It's not that no women benefit from screening, it's that most women do not. And I think all women should know this before they agree to a mammogram. So, an important note when discussing any intervention or medical treatment or test, some people benefit, and many people know someone who has. My stance is not to eliminate most medical practices, but to restrict their use to those who will benefit from them and to make sure that patients are properly informed before consenting. Consumer choice is the key, but there's no choice. It means nothing if people aren't informed of the consequences of the choices that they're making. And by the way, that's what we do at Wellness Forum. We are famous worldwide for creating the informed consumer, a person who often knows more than his or her doctor about the evidence for and against a particular screening test or drug or intervention or surgery or whatever, and can therefore make an intelligent decision and inform health professionals what their choices are. So it's one of the reasons you might want to consider membership. And we've created this great video that allows you on your own time to look at our libraries and look at what we have to offer, and then you can decide what you want to do. So you can send me an email. I'll be happy to provide you with that link. Common causes and conditions, part one, is this weekend, this coming weekend. We're going to talk about hypertension, AFib, UTIs, headaches and migraines, reflux, restless leg, thyroid disorders, kidney stones, and more questions. I hope you guys all come with questions. And then part two will be the following weekend. We're going to be talking about tetanus vaccines, hemorrhoids, food allergies and sensitivities, tinnitus, fibromyalgia, depression, and anxiety. So if you're interested in those programs, my email, I will send you details. All right. Okay, so the next news item has to do with several emails that I have received during this cancer campaign who've challenged me on my statements that I've made previously about hormone replacement therapy for women. And so, to summarize the emails, individuals continue to insist that pharmaceutical HRT is safe. Some have even suggested that it would be cruel to recommend against it for women who are experiencing miserable menopausal symptoms. So, I want to address this. I want to address the issue how safe and under what circumstances and that sort of thing, because there are risks that you should know about. Kind of the same thing I was talking about with the mammograms, right? So, to be clear, menopause is miserable for many women. Hot flashes and sleep disturbances and irritability from both of those are certainly not fun. They're also not normal. Menopause in many cultures is actually celebrated. In some places, contraception is not widely available, and views of menstruating women are not so positive. So, it's common for women to welcome menopause. Women in these cultures often have no symptoms other than the feelings of freedom from menstrual periods and the risk of pregnancy. Menopause is not a disease, but rather a natural transition that ensures that women will live long enough to raise their children to maturity. Historically, it would have been impossible for women to survive the harsh conditions of life if they'd been unable to sleep or run from predators and hunt for food due to hot flashes. So we'll start with the fact that miserable menopause is not normal. It's a symptom of poor health. I've never suggested that temporarily taking HRT until the underlying causes of miserable menopause was a terrible idea. I have stated that taking HRT for extended periods of time while the underlying causes of symptoms are not addressed is a bad idea, just like covering up symptoms of other conditions with drugs can be and usually is a bad idea. Women who have hot flashes, night sweats, and other misery are usually in this state because of one or all of the following. And I'll just give you some of the factors. They're overweight, they eat a poor diet, they drink too much alcohol, being sedentary, uncontrolled stress and unhappiness, depression and anxiety, and sometimes medications for other conditions that were never properly resolved. I was reading a transcript of an interview between two experts on women's health. It was on Medscape, Rachel Rubin and Stephanie Fabian. I wasn't familiar with either of them, but they're supposedly experts in this area. The argument they put forth to justify HRT was that for a woman with a uterus who takes an estrogen and progesterone product, there's a slightly increased risk of cancer. Fabian states in the interview, I'm talking the same as the increase in breast cancer risk of drinking 1 to 2 glasses of wine a night or being overweight or being inactive. We're really talking about less than one case per 1,000 women per year after about 5 years of hormone therapy. So it's a very small increased risk, end of quote. Based on today's census, this is an extra 63,000 cases of cancer per year in women. And if you're the woman who ends up with cancer, the risk doesn't seem very small to you at all. So let's assume for a moment that the 1 per 1,000 women taking hormones developing cancer is correct. But, and this is important, this would only be true if the only risk the woman had was due to taking HRT, but that's not the case. The usual reasons for taking HRT to relieve symptoms are risk factors for cancer, like the ones I listed before: being overweight, overconsumption of alcohol, uncontrolled glucose levels due to alcohol and fat consumption, including dairy products in the diet, lack of exercise, and more, which is what the doctor basically stated in the interview, but failed to acknowledge that the combination of all of these risk factors is significantly greater. HRT actually compounds an already high risk of cancer in many menopausal women and postmenopausal women due to their habits, and they're all modifiable. So, telling women who want to take HRT because they have miserable symptoms that the chance of cancer is 1 in 1,000 is incorrect. Once properly informed, women should take HRT for the shortest period possible until the underlying issues are addressed. But women aren't told to do this or assisted in changing their habits or their health in most medical settings. There are a couple of other things I want to point out that these doctors said in this article, in this interview, which was transcribed and posted. They stated factually incorrect information. For example, they justify the prescribing of HRT because they claim it helps to build strong bones. This is not true. Estrogen does not build strong bones. In fact, the Women's Health Initiative showed that two of the representations that had been routinely made to women that justify the prescribing of HRT, one was that it prevented osteoporosis and built strong bones, and the other is that it reduced the risk of heart disease, were proven to be not true. If you understand the causes of osteoporosis and coronary artery disease, it couldn't be true. I mean, there's no possible mechanism. Estrogen is not a substitute for weight-bearing exercise, a health-promoting diet, and sunlight, which do build strong bones, nor is it a means for thinning the blood in dehydrated people, which are at high risk of heart attack, or stopping the development of plaque in the arteries or reducing plasma cholesterol, all of which are known contributors to coronary artery disease. So at the end of the day, I stand by what I said. Hormone replacement therapy is a stopgap measure. That's the way it should be used until the underlying issues are corrected. And then you go off of this stuff because it increases the risk of cancer. And the second thing I'll say, I didn't discuss all the details in it here, is that bioidentical hormone replacement is not a better or safer option. And that's a different topic for a different day. But the bottom line is that women are constantly being misinformed about a whole lot of things. I guess that's the theme of this particular video today. And I'm all about being informed before you make choices, because what I listen to people say all day long who contact Wellness Forum is, if I'd known then, but I know now, I never would have. And then you can fill in the blank. Know now instead of after disaster strikes. My email address is pampopper@msn.com. If you're interested in any of the things I talked about here, signing the Cancer Pledge, participating in some of the weekend workshops we have coming up, etc., please send me an email. I'll be happy to respond to you right away. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you on Thursday with more news.